Hi, hello. So, welcome back. We are again here with 25 MCQs, and I've already given the code. So, let's begin with the MCQs. How many? Okay. So, the first question what I have is it's actually a biochem question. Which enzyme is responsible for the conjugation of bilirubin and is mainly located in? Basically, the location of the enzyme responsible for conjugation of bilirubin. The options are cytoplasm, endoplasmic reticulum, mitochondria, and Golgi apparatus. Am I audible first? I think I'll repeat the question once. Which enzyme is responsible for the conjugation of bilirubin and is mainly located in cytoplasm, endoplasmic reticulum, mitochondria, or Golgi apparatus? So yeah, the answer here is endoplasmic reticulum. So before that, we have to know which is the enzyme which is required for the conjugation of bilirubin, and that is the glucuronidase transferase, and located in the endoplasmic reticulum. So this you have to remember. Mitochondria, no, it is in endoplasmic reticulum. Yeah. Next question we have: in case of a opioid toxicity, the most important treatment step is number one, airway protection and ventilatory maintenance. Second one is cytoplasm is not the answer. Second one is gastric lavage and activated charcoal administration. Third is intravenous naloxone administration, and fourth is administration of intravenous dextrose and thiamine. So we have opioid intoxication patient coming to you. So which is the important treatment in this? At airway management and ventilatory support, gastric lavage and charcoal administration, intravenous naloxone, and administration of dextrose and thiamine IV. So anyone wants to answer this? Okay, the answer here is anyone? Okay, I will tell. The answer here is first is that airway management and ventilatory support, because in intoxication basically what happens, there will be respiratory depression will be present. So before all that, naloxone we have to give, but not that important. Second, no, gastric lavage, activated charcoal will be there, but it will be after the ventilatory support. Yeah, after ventilatory management only we have to do gastric lavage, then naloxone will be there. So yeah, the third next question we have, there is a 23-year-old woman, G2P1L1, at 33 weeks of gestation, and she is diagnosed with spontaneous preterm labor. The senior resident instructed you to give the patient antenatal steroids and a tocolytic. Which of the following drug will you not choose? Which of the following drugs will you not choose? Atosiban, dopamine, nifedipine, isosuprin. This is anyone? A 23-year-old woman comes to you with G2P1L1 at 33 weeks of gestation, diagnosed with spontaneous preterm labor, and you have to give a steroid and a tocolytic. So which of the following drug will you not choose? Atosiban, dopamine, nifedipine, or isosuprin? Anyone wants to answer this? I think the answers are coming late here or something. Okay, so the answer is dopamine. But dopamine has don't know. Okay, the dopamine has no role in this, basically in the uterus. So that's why other we can give, but dopamine cannot give in this. So next question we have. See here, it's a genetic question. Next we have the chance of passing a genetic disease H by affected parents to their first child is 0.16. If they plan to have 2 children, what is the probability that both of the children will have the disease? 0.2944, 0.32, 0.0032, and 0.0256. This you have to calculate basically. If you don't have pen, you won't be getting pen and paper in the exam also. But yeah. Okay, I'll just tell the answer. The answer is 0.0256, and what they have given is the probability of is at 0.0256. In this scenario, the chance of each child having the disease is 0.16. They have given the question only. The second child having the disease is independent of the first child having it. So the events are statistically independent. Applying the multiplication rule of probability, the probability of both the children having the disease is 0.16 into 0.16. That is 0.0256. Okay. Next question we have. Which is the most common level at which lumbar disc prolapse occurs? L5S1, L4 L5, L2 L3, L3 L4. Which is the most common level at which lumbar disc prolapse occurs? L5S1, L4 L5, L2 L3 and L3 L4. L5S1 is not the answer. L3 L4 is also not the answer. No. The answer here is L4 L5. See, the common sites are first is L4 L5, then L5S1, then L3 L4, then L2 L3 and then L1 L1. So the most common is L4 L5. So next question we have. A 23-year-old primiparous woman with grade 2 genuine stress incontinence did not respond to conservative management. Which of the following surgeries will not be beneficial for her condition? Cholera operation, tension-free vaginal tapping, birth, colposuspension and Lateral procedure. I'll repeat once again. A 24-year-old woman comes to you. She is a primiparous with grade 2 genuine stress incontinence and she did not respond to any conservative management. So which of the following surgery will be beneficial for her? First is prayer operation, tension-free vaginal tapping, birth, colposuspension and Lateral procedure. Okay, the answer here is that is the last one, that is Lateral procedure, but it is not beneficial in this birth. No, birth and colpo will be beneficial. Lateral basically it is used in vesicovaginal fistula, so therefore it will not be used. And prayer, tension free and births will be used. It will be beneficial basically. So next we have 32-year-old man is brought to the casualty after he developed sudden onset dyspnea, chest pain and palpitation at a party. Then his blood pressure is 100/62 mmHg. So what is the drug of choice to treat this condition? Procainamide, adenosine, verapamil, propranolol. So I'll repeat. 32-year-old patient come to you with chest pain, dyspnea, sudden onset dyspnea and palpitations. BP is 100/62. So which is the drug of choice here to treat the patient? Procainamide, adenosine, verapamil, propranolol. They have given one ECG here, which I cannot show, but okay, I will tell that the ECG is showing PSVT, that is a paroxysmal supraventricular tachycardia is present in the ECG. So now if you can answer, what will you give? Procainamide, adenosine, verapamil or propranolol? Propranolol, no. See, the patient is stable and you have PSVT. So which drug will you give? Procainamide, adenosine, verapamil, propranolol. Yeah, adenosine is right. See, suppose if the patient is unstable, you have to do cardioversion first. And adenosine is basically given when the patient is stable and comes to the... Adenosine is the first line agent, then calcium CCB is there, beta blocker there, procainamide is also there. But first line is adenosine. Next one. What is the most common extracolonic cancer in patients with mutation in MMR gene? The answer The options are gastric carcinoma, breast carcinoma, endometrial carcinoma, or ovarian carcinoma. Most common extracolonic cancer in patients with mutation in MMR genes. Gastric carcinoma, breast carcinoma, endometrial, or ovarian. In this you have to remember. The answer here is endometrial carcinoma. Mutated MMR gene is seen in endometrial carcinoma. That's it. Then which of the following is the most common cause of septal perforation? Septal abscess, trauma, syphilis, or TB? Which of the following is the most common cause of septal perforation? Septal abscess, trauma, syphilis, or TB? If anyone knows the answer, which of the following is the most common cause of septal perforation? Septal abscess, trauma, syphilis, or TB? Your answer is trauma. Trauma is the most common cause of septal perforation. Next we have an anxious mother brought her 4-year-old daughter to the pediatrician. The girl was passing loose, bulky stools for the past 4 days. This was often associated with pain in the abdomen. The pediatrician ordered stool examination which shows the following organism. So which vitamin deficiency is the child at a greatest risk for? See the image they have given, it is a Giardia lamblia. The organism what they have given in the stool. So I repeat, the answer is 4-year-old daughter is there. Loose, bulky stools for past 4 days associated with pain in the abdomen. Stool examination shows this Giardia lamblia is present. Which vitamin deficiency is the child? The options are vitamin B1, vitamin A, vitamin B6, vitamin C. Vitamin B12 is not there. So your options are vitamin B1, A, B6 and C. So anyone wants to answer now? Vitamin B12 is not there in the answer. Yeah, it is fat soluble. So the answer here is vitamin A deficiency will occur in Giardia. Now next question we have, a patient presents to you with sudden onset fever with chills and malaise. On examination you saw splenomegaly is present. Bone marrow picture is shown in the image. Which of the following drugs is not used in the treatment of this condition? So the image I can tell you, it is showing the image has macrophages which are infected with, basically it is Leishman and Donovan is there, bodies are there in the pathology. So you can tell it is leishmaniasis. Now you can tell fever with chills and malaise, splenomegaly, and it is leishmania. And which of the following drugs is not used in the treatment of this condition? So the options are paramomycin, liposomal amphotericin B, hydroxychloroquine, or miltefosine. So anyone wants to answer this? Which of the following drug is not used? Paramomycin, liposomal amphotericin B, hydroxychloroquine, and miltefosine. Yeah, hydroxychloroquine is the right answer. See, the drug of choice for this condition is amphotericin B. Liposomal amphotericin B is the drug of choice. Others can be used, but HCQ can't be used. It's not the choice of treatment here. So next we have, third one. Next we have a 36-year-old man is diagnosed with cholera. Which of the following drug would you prescribe to his family members to prevent the spread of the disease? The options are tetracycline, azithromycin, ciprofloxacin, or cotrimoxazole. You have cholera, 36-year-old with cholera. Which of the following drug would you prescribe for the family members to prevent the spread? Tetracycline, azithromycin, ciprofloxacin, or cotrimoxazole. Basically, no, 3 is not the answer. Basically, they are asking what is the drug of choice for chemoprophylaxis of cholera, or to prevent the spread. So, which is the drug of choice for that? Tetracycline, yeah, tetracycline is the answer. Is the drug of choice for chemoprophylaxis of cholera. So, here, what is the dose? Here in adults, we can give for a 3-day, twice daily of 500 mg. For children, it is 125 mg. So you have to remember dose. If you want 500 mg is that for 3 days you have to give continuously, twice daily BD. Next question we have. Tetracycline. Given below is the hemogram of a patient. Calculate the Menzer index. That is, they have given hemoglobin is 10%, RBC 6 million, reticulocyte count is 0.6, MCV 60 femtoliter, MCH 20, and the peripheral smear shows microcytic hypochromic picture. So you have to calculate the Menzer index. So the options are 10, 12, 30, 60. 10, 12, 30 and 6. So this you have to calculate. So what is Menzer index? The formula for Menzer index is, that is MCV by TRBC. So it is 60 by 6. The answer here is 10. The index is used to differentiate between iron deficiency anemia and beta thalassemia rate. If the index is less than 13, it is most likely to be thalassemia rate. Basically, if it is greater than 14, it will be iron deficiency, less than 12, it will be beta thalassemia minor. So you have to remember the formula, it is MCV by TRBC. Next we have a 16-year-old girl with primary amenorrhea has come to your clinic. A 47-year-old man came to emergency OPD. Okay. Next question we have a 16-year-old girl with primary amenorrhea has come to your clinic. On examination, thalars is absent. She has a normal stature and her karyotype is 46 HH. Which investigation would you prefer to perform first? Serum testosterone, USG pelvis, LHFSH or hysterosalpingogram? A 16-year-old. The 16-year-old comes to you with primary amenorrhea. Examination, thalars is absent. She has normal stature. Karyotype is normal, that is 46 HH. Which investigation would you prefer to perform first? Testosterone, USG pelvis, LHFSH or hysterosalpingogram? Three, yeah. LHFSH. Normally, when a patient comes to with amenorrhea, it is not there. Thalars is there. Thalars is absent. You do a hormonal assay, that is LHFSH. Following LHFSH, you do USG pelvis and MRI pelvis for examination. 3 LHFSH. One question is there here. A 47-year-old man came in emergency OPD and complained that while eating fish, something got stuck in his throat. I was causing pain and lot of discomfort on examination. I don't know why this question they have given. Okay. Next question we have here is patient with a normal BMI comes with a history of binge eating, following by inappropriate compensative behavior. As per the DSM-5 criteria, you can make a diagnosis of bulimia nervosa if this occurs on average for at least. This is to tell the duration for bulimia nervosa. Once a week for 3 months, twice a week for 3 months, thrice a week for 3 months, or throughout a week for 1 month. So anyone can tell the So how will you diagnose a patient with bulimia nervosa? The options are once a week for 3 months, twice a week for 3 months, thrice a week for 3 months, and throughout a week for 1 month. Okay, the answer here is, if anyone, second no. So the answer here is the first one only. It should be, you can diagnose by telling only once a week for 3 months as per the DSM-5 criteria. The question is, fishbone is stuck. Okay. You can tell the answer by yourself only. Okay, the next question we have. The chief artery of the superior lateral surface of the cerebral hemisphere is anterior cerebral artery, middle cerebral artery, posterior cerebral artery, or lateral cerebral artery. This is an anatomy question. The chief artery of the superior lateral surface of the cerebral hemisphere is anterior cerebral artery, middle, posterior, or lateral? Superior lateral surface. Anyone wants to answer this? Pyriform fossa. It's not, you have to tell the artery basically. Which is the chief artery of the superior lateral surface of the cerebral hemisphere? So the answer here is middle cerebral artery. Yeah, you're right, middle cerebral artery. So you have to remember this superior lateral surface, if it is there, it is middle cerebral artery. If it is the medial surface of the brain, it is the anterior cerebral artery. And if it is the inferior surface, we have the posterior cerebral artery. So in that we have to remember. Now a young child with an unknown immunization status is suspected to having a whooping cough. Which of the following methods will you prefer to use to collect a specimen for a culture? Cuff plate method, pre-oral swab, pre-nasal swab, or a post-nasal swab? I'll repeat. A young child with unknown immunization history suspected to having a whooping cough. Which of the following methods will you prefer to use to collect a specimen for a culture? Cuff plate, pre-oral swab, pre-nasal, or post-nasal? First one, cuff plate. No, we don't use cuff plate method here. First of all, I want to tell you that it is basically history of whooping cough, and whooping cough is caused by, we all know, Bordetella pertussis. So the most effective method here is pre-nasal, not post-nasal also. The most effective method for collecting it is pre-nasal or nasopharyngeal swab. See what cuff plate, what you were telling me here, it is written that but it is not. No, the preferred is pre-nasal only. Cuff plate also we can use, post-nasal also we can use. Now the next question we have. A 30-year-old woman presents, but old question, cuff plate is no more used due to high risk of sample collector. Yes. Next question we have. A 30-year-old woman presents with you with hypertension, chest pain, and cramping of leg. A chest radiograph was taken which revealed the condition in the stone image below. What is the likely cause of hypertension in the patient? So the X-ray is given here, and basically X-ray shows it is having coarctation of aorta. Okay, now you can tell the answer. See, again I will repeat. 30-year-old patient, hypertension, chest pain, cramping of leg. Radiograph shows coarctation of aorta. And what is the likely cause of hypertension in this patient? Oh, the answer is that only, sorry. It is, the options are coarctation of aorta, essential hypertension, aortic aneurysm, and aortoarteritis. So basically on the X-ray only tell it is coarctation of aorta. So this question I only told the answer. Okay. Next question we have. A preterm neonate is admitted to the NICU who received supplemental oxygen and is being screened for retinopathy of prematurity. And fundus examination was done which reveals a subtotal retinal detachment. How will you stage the disease? Stage 2, 3, 4 or 5? Preterm neonate was admitted to NICU and who received supplemental oxygen and is seen for retinopathy of prematurity, So fundus examination reveals a subtotal retinal detachment. How will you stage the disease? Stage 2, 3, 4 or 5? So you might be knowing there are 5 stages of retinopathy of maturity. So what is the stage here? And this you have to remember. Stage 4, yeah, stage 4 is the answer. So I will tell you all the stages once. Stage 1 is demarcation line formation at the edge of the vessels dividing the vascular from the avascular retina. Second one is intraretinal ridge formation. Third one is ridge with extraretinal fibrovascular proliferation into the vitreous. And the fourth is the answer, that is the subtotal retinal detachment. And fifth, what you are telling is total retinal detachment. So fourth is the answer here. So one more image where it is. Okay. A middle-aged man was on treatment of lepromatous leprosy. Presents to you with painful lesions for 1 month. On examination, glove and stocking pattern of anesthesia is noted. What is the drug of choice for this condition? Steroids, thalidomide, clofazimine or rifampicin? See, a middle-aged man on treatment for lepromatous leprosy presents to you with the following painful lesions for 1 month. On examination, glove and stocking pattern anesthesia is noted. What is the drug of choice for this condition? So steroids, thalidomide, clofazimine, rifampicin. No, the answer is not rifampicin. The answer is, anyone wants to tell? 3. Yeah, the answer is clofazimine. See, basically they have given the image, but I can't show you now. See, the given scenario points toward a diagnosis of erythema nodosum leprosum or type 2 lepra reaction. That's why the drug of choice is oral corticosteroids. Again, my mistake. It is called steroids. The answer is steroids. I only did clofazimine. The answer here is steroids, but it is a lepra 2 reaction. So the next question, we have a 7-year-old boy is posted for laparoscopic appendectomy. Which of the following inhalational agents is preferred for the induction? Halothane, isoflurane, sevoflurane, desflurane. A 7-year-old boy comes to you with boy is posted for laparoscopic appendectomy. Which of the following inhalational agents is preferred for the induction? Halothane, isoflurane, sevoflurane, desflurane. My answer is right. Anyone wants to tell the answer? Yeah, the answer is sevoflurane. Yeah, because it is a pediatric and that's why we give. In pediatric age group, the agent of choice is sevoflurane. Because isoflurane and desflurane are airway irritant, and they are not used in induction of anesthesia as they can precipitate laryngospasm. These agents are only used during maintenance of anesthesia. See, I'll tell you the answer at the end. See, which of the following is the most abundant intracellular anion? The answer is phosphate, protein, chloride or bicarbonate. So I will repeat again, which of the following is the most abundant intracellular anion? Phosphate, protein, chloride or bicarbonate. Anyone wants to answer this? Which of the following is the most abundant intracellular anion? Phosphate, protein, chloride or bicarbonate. This we have to remember. See, the answer here is phosphate. See, I will tell you this. There are two things, ICF and ECF. In ICF, the major anion is phosphate. Bicarbonate, no. Bicarbonate? No. See, in ICF it is the major anion is phosphate, whereas if you see the ECF it is chloride. So you have to remember that the protein content in ICF is 8 times greater than the plasma. Yeah, phosphate is the answer. Now next question we have, as a healthcare worker working in a COVID hospital, you receive the following vaccine. And the vaccine, the image here is Covaxin, that is COVID only. Which of the following is not an adverse event related to this vaccine? Cough, tremors, see, yeah. I will repeat again. They have given a photo of a vaccine, that is Covaxin, and which of the following is not an adverse event related to this vaccine, that is cough, tremors, demyelinating disorders, dizziness, giddiness. So what can be the answer? Cough, tremors, demyelinating disorders, dizziness or giddiness. Which is not an adverse event. Tremor. No, tremor is not the answer. See, the adverse effect they have for Covishield and Covaxin, there are different adverse effects. So what differentiates between the Covaxin and Covishield is demyelinating disorders. So demyelinating disorders it is a rare, but it will be there in Covishield, not in Covaxin. So they have given a differentiation between Covishield and Covaxin adverse effects. So they are mostly, see, fever is there in both, injection site pain, swelling is there, headache, body. See the okay. So once okay. See, I will tell you once again. It is a Covaxin is given to you. Okay, which is not an adverse event related to this vaccine. Cough, tremors, demyelinating disorders, or the last option is dizziness, giddiness. So demyelinating, what I was telling you, demyelinating is a complication of Covishield and not Covaxin. So that's basically differentiate between Covishield and Covaxin. So you have to remember that point. Otherwise, both have fever, cough, sweating, and all that. It will be there in both as an adverse effect. So then we have, which type of gastric ulcer has increased gastric acid levels? Which type of gastric ulcer has increased gastric acid levels? Type 1, type 4, type 5 and type 3. Anyone wants to answer this? Which type of gastric ulcer has increased gastric acid levels? Type 1, type 4, type 5 and type 3. So you might be knowing there are 4 types of gastric ulcers. So in that way, if you can answer this from okay, type 3, no. In type 3, the acid percent is normal or high. Yeah, type 2 and type 3. Type 3 is the answer. Both type 2 also and type 3. Type 2 they haven't given in the options. Type 2 and type 3 has increased acid percent. And otherwise it is low in type 1, 2 and 4. So the answer here is type 3. So the last question we are having, which of the following is not a B lymphocyte marker? CD19, CD20, CD23 and CD13. So which of the following is not a B lymphocyte marker? CD19, 20, 23 or 13? So here you have to remember this. See, CD13 is not a B lymphocyte marker here. Rest all CD19, 20, 23. They're all, because CD13 is an antigen of monocyte or macrophage. Yeah, 13 is the right answer. So CD13 is not a B lymphocyte marker. So yeah, that's all. 25 MCQs are over today. Anyone has any questions? Okay, I'll finish it off. So yeah, 25 questions are over. Now we'll meet you at 11 o'clock. Thank you.